Concussion and post-concussion syndrome. In a concussion injury, either due to a blow to the head or due to rapid deceleration, which occurs in a whiplash injury, even if you don't hit your head, just the sudden deceleration of your head, with the brain floating inside the fluid medium within the skull, the brain slams into the skull bones. And this results in bruising and twisting and shearing of brain cells, which sets off a cascade of events that damage the outer skin of the brain cell. This is known as the cell membrane. And when the membrane gets damaged, sodium starts rushing into the cell along with calcium, and the sodium causes swelling, and the calcium causes blood vessels to constrict, so now you're getting less oxygen to the brain, so it has less of a chance to repair the damage. At the same time, magnesium and potassium actually exit the nerve cell, and the loss of magnesium, it's important because magnesium is also required for the cell to make energy to repair itself. Now you have less magnesium inside the nerve cell, which is now a hindrance to recovery. There's also a massive release of a brain chemical called L-glutamate. And when you have massive amounts being released, it's very toxic to brain cells. It can kill them and damage them in a significant way. And the injury also causes inflammation around the cell membrane that then spreads through the entire brain cell. As well, the energy factories in the brain cell, called the mitochondria, they become damaged and they start to leak these electrons out of their membrane, which then interact with oxygen and form very damaging free radicals. So we see free radicals in everyday life. If I take an apple and I cut it in half, oxygen, which is very reactive, will slowly cause the apple to turn brown and to rot. So that's what free radical damage looks like. And you speed that up when you have a concussion injury, because oxygen is now interacting with all of these reactive electrons that are leaking out of the energy factory, the mitochondria. And with the mitochondria damage, that's the energy factory. Now the cell is having a hard time making the energy that it needs to repair itself. So this is why physical and mental rest are imperative in the early stages of recovery to allow the brain to heal. And avoiding a second concussion before the first concussion has resolved is vitally important, as a second impact is very likely to lead to permanent brain damage. But what's often overlooked in the management of concussion and post-concussion syndrome is the role that diet and nutritional medicine can play in providing the brain with nutrients that have been shown to help repair the nerve cell membrane and reduce inflammation and minimize free radical damage and improve brain cell energy production so it can repair itself and reduce the damage from L-glutamate, which can be very toxic, and repair other brain cell structures, as well as help to rebalance the brain chemicals, the neurotransmitters that you need for concentration, for alertness, for sleeping, for motivation, to prevent depression from setting in, and to help preserve enough of the memory chemical acetylcholine so that you can help to support memory function as well. So this feedback report explains the nutrition and lifestyle strategies you should consider and speak to your doctor about that may help you speed the healing of a concussion and help overcome symptoms of concussion and post-concussion syndrome. Now, we've included the scientific references to make sure that if you want to do any further reading or substantiate what's here, you have access to all of those scientific documents. So I hope you find this to be informative and empowering. Thanks so much for watching.